Aloha!
Talofa.
And welcome to Maoli Talk, Real Polynesians, Real Talk. I'm Delia.
And I'm Fosi. Welcome to our Fale. Today we'll be talking about Polynesians and mental health. Mental health is a serious issue that impacts our Polynesian communities. In the future, we'll be covering more topics on this issue in our future episodes.
But today it's really about raising awareness and sharing some information. So we thank you for joining us for this serious but very important topic.
Yes. All those mental health issues that we talk about, that we hear about today, we never talked about that growing up. I never was made aware of those things.
Yeah, I mean, the same thing is with me growing up. Grew up in the 80s. I didn't know a whole lot of people who committed suicide. I don't even know if I knew the term depression or depressed. It wasn't common, certainly wasn't common. Or mental health was not talked about, mental illness was not talked about. Mm-hmm. And so, in this day and age, it is certainly a different world. And we do know that Polynesians suffer from mental illness, and the impact of that is deeply and widely felt in our communities, and that's why we really wanted to talk about this today and raise awareness about it.
Yes.
Can you talk really, a little bit about what you do, Hun, and how, if you've seen like Samoans in the mental health system here in Hawaii?
So I've been working with adult mental health over 15 years, and there hasn't been too many Samoan that showed up in the system. There was only, from my years of experience, there've only been a handful of Samoans that have showed up in the system.
What do you attribute that to?
I think some of it has to do with some cultural factors. Mm-hmm. Like if maybe shame, they don't want to come out and share that
what's going on in the family.
What's going on in the family, or if they have an issue, it's not something that we share. It's not something that we openly discuss or talk about.
And interestingly enough, there is a very small percentage of Samoan families and youth that end up in the foster care system. Right. So I don't know if it's more of a cultural thing where you kind of don't share what's going on, you keep it to yourself. What about access to resources and kind of awareness? Do you think that maybe Samoan families are not as aware about the resources out there until things get really bad?
I think so. I think when it gets to that point where they can't control, or like if that person in their family is acting out really, really dangerous for the family, I think there's a tendency for the family members to reach out and to seek out resources that could help their loved one.
And so that's really important then, to raise awareness
for
our Polynesian community, our Pacific Islander community, and to kind of link access to resources. So I wanted to just share some statistics about Native Hawaiians, because we do have a lot of data being in Hawaii about Native Hawaiians. We know that Native Hawaiians are disproportionately represented in many of the mental health areas. And we know it impacts Kanaka across Hawaii from Keiki to Kupuna. I'm reading here from the Office of Hawaiian Affairs. And we know it's linked to suicide, substance abuse, partner violence, homelessness, incarceration, and numerous issues in our community. Our keiki, unfortunately, are overrepresented as victims of abuse and neglect. Yeah. And I know that from working in the foster care field, that over 50% of the children and families involved in foster care are unfortunately Native Hawaiian. Youth and young adults are 2.3 times more likely to die by suicide than their Caucasian peers. 9th grade Native Hawaiian girls report the highest rate of intentional self-harm, almost 47%.
Wow.
Youth suicide, I know it's just disheartening. Ideation, attempt, and death rates are the highest amongst Native Hawaiians in Hawaii. And our kupuna, our elderly, depressive disorder is 13.4% higher than anyone else in Hawaii. So it's, really, when you look at the statistic, it's very disheartening, and there's a lot of reasons. There's some research and some data, but the main thing is we know that our Native Hawaiians are suffering from mental health issues and illnesses in our community, and it impacts our families. What about the stigma? Is there a stigma about like reaching out to get help, mental health, like even therapy? Is it something that's looked down upon, or is too palangi?
We've never talked about therapy. We've never heard of therapy. The only kind of therapy that we've gotten is, just we don't talk about it. We
ignore it and suppress it.
We didn't know what to do except for like coming up. We just got pushed in the back and got lickings and and never really talked about it. So we don't understand what all that stuff is. But there's definitely a lot of resources now that people could definitely reach out to and tap into and understand. And I think a lot of it has to do with educating and learning about these things a lot more so now than we did coming up.
And so that's a good thing, right?
Absolutely.
That there's more resources, there's more dialogue, and we're hoping here to contribute to that discussion, to that dialogue in the community, and encourage our Pacific Islanders, our Polynesians, our Hawaiians and Samoans to be aware and to get help and to destigmatize and support one another.
And there is, wherever you live in this world, whether in the U.S. or other countries, there are numbers that you can call and you can reach out to for help. And please do so, because we need to break that stigma. We need to break
that
those cycles, and everybody needs somebody to talk to.
And in our YouTube page below here, we will be sharing some links and some information that may be helpful to you or a family member. So, Han, I really want to end by sharing a little bit of kind of how we as a family address some of the mental health issues. Or when I talk about mental health, I'm not just talking about mental illness, because we will be in the future talking about things like suicide and depression, but really how we take care of our mental health. And in our family, I do go to therapy. I found that it's very helpful to talk to a qualified, neutral party. And I go every month, once a month, just kind of like a tune up, and I find that it's really helpful for me personally. What do you think about therapy?
In the beginning, when we talked about this as a family, it was kind of difficult because I didn't feel like I needed to talk
even
to
though
anybody.
Ironically you're in the mental health field.
Even though I'm in the mental health field
and you advocate for therapy to your clients.
Over the years I have learned, and so now with our family, I've seen the benefits of talking to somebody that can really provide you with great insight, skills, education on how you can help yourself,
strategies, interventions.
Right.
And we've even had our son with us in therapeutic sessions to learn and get more strategies as a family on how to deal with conflict. I think it's really good for couples as well. Couple therapy, family therapy. And we want to talk more in the future about different kinds of therapy, not just a Western modality or a Western view, but how to incorporate more native ways of the things that are more authentic to us. But something like therapy was something that was difficult because there was a stigma around it for me growing up, and I found it to be really helpful for myself and in our family as well.
I think so, yeah. And for myself, therapy has definitely helped me in such a big way. I never thought I would see myself as seeing a therapist, but it's very interesting to be on the other side and I see both sides, because I do provide therapy for my kids what I do at Farrington High School, and then now experiencing the other side as a person seeking out therapy, it opens up your eyes, and it's something that is good for all of us, especially us Polynesians that don't talk about this kind of stuff, that we don't go and see a therapist. It's really important that that we open up ourselves and be okay with that.
Yeah, and again, we really just wanted to raise awareness this episode, this issue. We hope that it's been helpful in some ways, sharing some of those stats, sharing some of the resources on our YouTube page. In the future, we want to hear your stories. What are some things about mental health that you'd like us to talk about that are really important? Share some of your stories. I know this is a very vulnerable topic, and we appreciate you letting us into your living rooms and your phones to talk about this.
Thank you so much. Please subscribe, like, share,
comment,
ring the bell,
yes,
and most importantly, comment. We want to
Yeah.
hear your stories. We want to hear
Do.
your, your experiences.
And
So
until
thank
next
you.
time, we mahalo you for joining us. Aloha, malama pono.
Tofase fua.